I just am really excited to be able to share a few of the strategies that Providence's Mayor David Cicilline has put into place with the task force that he appointed as part of an executive order when he was inaugurated for a second term. We have 4-year terms for Mayor of Providence. And he was inaugurated for a second term, and one of his first acts was to sign an executive order. In January 2007, he announced the creation of the Poverty Work and Opportunity Task Force. He formally charged the task force with developing and defining an agenda to grow, retain, and reclaim the middle class in Providence by accomplishing the following goals. First, increase the ability of low-income families in Providence to improve their economic status. And second, decrease barriers to economic advancement facing families living in the city. And so this was a broad charge, but he was specifically interested in some practical recommendations that could be done at the local level to ameliorate some of the worst effects of poverty and really be on a strategic path to reduce the high numbers of people in poverty in Rhode Island, in Providence, Rhode Island. We were just laughing. My state is kind of a microcosm. It's sort of when you look at Rhode Island as a whole before I get to Providence, we have 1 million people, you have 1 million people. We have about 29%, 28% of our kids of color, minority children. In some communities there will be majority children. Same kind of demographic profile here. We have around 17% of children in Rhode Island in poverty, and I know the number is a little bit lower here, but I think Cora's presentation really did a great job of exposing pockets of poverty that you have here in Westchester County. And we have a similar story to tell in Providence, in the Rhode Island community. We have what we call the core cities, the 5 urban areas in which more than 2/3 of our poor children, as many as 3/4 of our poor children live in these 5 core cities. Providence, Pawtucket, and Central Falls, and Woonsocket are 4 of them. Well, the 5th one is Newport, America's first resort. It has such a rich person's kind of reputation, for good reason, if you've ever driven down Bellevue Avenue or Ocean Drive, if you've been on vacation in my state. But it's a neighborhood, a community of neighborhoods, just like Westchester is. And there are pockets of childhood poverty in Newport to the point where almost 25% of the kids are living below the poverty level. So talk about the hidden children. The Newport sort of resort community has this issue of childhood poverty in their midst. So in this situation with Mayor Cicilline, he turned to Rhode Island Kids Count, which is a children's public policy organization that does statewide work similar to the work you all do. And I was just so impressed by Allison's look back. I want to just give you this kind of reassuring feedback that as I heard your look back and your priorities for the next year, we are so on the same path because we're both looking at what are the research-based solutions to try to improve children's lives. And we've just launched the Nurse Family Partnership Program in Rhode Island after having that be a dream of ours for 10 years. So we're a statewide organization. So when our mayor of Providence, Providence is our capital city, obviously 164,000 people, with a huge childhood poverty problem. When Mayor Cicilline was first elected, our childhood poverty, based on the most recent census that we have, was that 41% of Providence children live below the poverty level. So at the time it was 41%, just several years ago. Providence was tied with New Orleans as the 3rd poorest city in America for kids. So if you're the mayor of Providence, this is right at you, Hartford is #1, Brownsville, Texas is #2, that border community, and we were tied with New Orleans. So what stark relief we felt when Katrina happened, and you could just see the portrait, unfortunately, the shameful portrait of kids in New Orleans, and it would say, Providence is tied with New Orleans. Now, clearly, Providence was situated in Rhode Island, who over the years had done more public policies to try to ameliorate the effects of childhood poverty, leading the country in children's health insurance coverage, doing a lot with early childhood education, but the numbers are the numbers, and you just don't want those kind of statistics and the human reality that means affecting your community. So what he did was, first thing he did is he came to us and said, could you facilitate this? It was an honor to be asked, even though we don't normally do local work. It seems so important, and we have a saying in Rhode Island, as goes Providence, so goes the state. And I know you have those kinds of analogies in New York, obviously. He put together a task force of about 35 leaders of the community, people working on the front lines with kids and families, some youth, a few parents. It was a very diverse and very passionate committee. And he was very, very clear. He didn't want a report that would sit on a shelf, and he didn't want something to be so not right-sized for a local leader and what a local leader could do that it wouldn't really have any impact. So he really charged the task force to think about some practical ways that right here, right now in Providence, we could start on this journey of reducing the poverty level. And so you have some of these materials, and I'm just going to go over a few of the categories that we worked in that were very important in terms of making sure we were on the right track. There were a few threshold kind of questions that we were making sure that we did a lens, sort of put them through this washing machine before they emerged as a viable recommendation. We wanted to be sure that any recommendation that would come forth would be meaningful, that implementing this particular strategy would actually have a significant and positive impact on people in Providence, and that there are data showing need, and that you could measure this over time. Measurable. Is this recommendation something that it's possible to make a measurable change within 3 years? Because we needed to try to build some momentum. Is it effective? Is there a research base showing effectiveness and promising models in other cities? And obviously from Cora and Allison's reports, that's something that is so completely core to this organization's mission. Is it feasible? Is there a realistic resource or development strategy to accomplish this objective? So sometimes you say, what are our troops on the ground here in Westchester? What are some things that are almost ready to go and just need some of that energy that comes with an official launch of something like this to give it wind beneath its feet so it can actually take off? And is there an ability to implement this particular recommendation if it were to be put into place? So those were sort of the broad kind of like, this is the criteria. And we got a lot of help on that from Brookings, who was doing a lot of some of the earlier work on what are some practical solutions to reducing childhood poverty.